It is 6:40. It's easy to overlook the early signs of ovarian cancer. I talked with Rudy Best with the Hope Light Project about some of the warning signs to look for in this morning's To Your Health. Take a listen.
We're joined by Rudy Best with the Hope Light Foundation. And Rudy, one of the things that most people don't realize is ovarian cancer, how many people it affects. I mean, the study we have here says 1 in 78 women will be diagnosed with ovarian cancer in their lifetime. That's a staggering number.
Yes, it is. And the bad part about it is there are no screening tests for ovarian cancer, such as they are for cervical cancer.
And on that topic right there, it says right there that a pap test does not detect ovarian cancer. And I'm sure there's a lot of people under the misconception that it does.
That's correct. You know, unfortunately, the pap test, there is no other test for ovarian cancer other than there is a CA-125 that is not reliable. And then, of course, then there's the transvaginal ultrasound, TVUS, that also can be used. But again, the only way to detect ovarian cancer is with a biopsy. And it's done by a gynecologic oncologist. And they biopsy the tumor. It's sent out for a lab, comes back with the results. And that's the only 100% proof way of diagnosing the presence of ovarian cancer.
So is there a certain age that people need to start taking these tests? Is there, just recommended intervals for getting the testing done, or should you just basically go off symptoms and family history?
The latter part is exactly correct. I think the biggest thing is that, first of all, it affects all ages. It's not an old person's disease. The best thing to do is, if you have a family history, is to get with a genetic counselor, have some genetic testing performed, and if it's in your family, they look for 2 genes, BRCA1 and BRCA2, which is also associated with breast cancer. And normally these genes protect you from getting ovarian or breast cancer, but in a lot of cases the genes mutate, and when they mutate, that's when they become ovarian cancerous and breast cancer. So that's what they look at as far as the DNA that's obtained from the genetic counseling to find out if those genes are present.
Well, Rudy, we're getting short on time, but there is so much that we can get to on this. One of the things I really like for our viewers to know, though, what are the typical symptoms of ovarian cancer?
The typical symptoms of ovarian cancer are, number 1, bloating, pelvic or abdominal pain, urinary frequency and urgency, and difficult eating or feeling full quickly. Now, if these persist over a period of 2 weeks or so, it's advised that you see your physician and take it from there. As far as the next actions are concerned, it could be, he could refer you to a gynecologic oncologist.
Well, Rudy, we appreciate you taking the time to talk to us about this very serious situation. We'll get this up on our website. You have a great day. Thank you.
Thank you very much for having us. It's our pleasure.